Medicare Wellness visits promote good health through disease prevention and early detection, and provide opportunities to plan for other Medicare preventive services. But billing the wrong visit or at the wrong time can result in a denied claim. To avoid that, this video will provide an overview of 3 different Medicare Wellness visits, when to offer them, and the appropriate billing codes. Stick around to the end, and we'll share additional quick tips for avoiding denial of claims and coordinating with your clinical team to streamline these visits. Let's start with an introduction to the 3 types of Medicare Wellness visits. The first type is the Initial Preventive Physical Exam. The second type is the Initial Annual Wellness Visit. And the third type is the Subsequent Annual Wellness Visit. Now, let's talk about when you should offer these visits, what each visit is for, and which HCPCS codes should be used. Let's start with the Initial Preventive Physical Exam, sometimes called the Welcome to Medicare visit. This visit should be used within the first year of a patient's enrollment in Medicare Part B. It is covered once per lifetime. Use this visit as an opportunity to review your patient's medical and social health history, potential depression risk factors, and their functional ability. You should also conduct an exam to measure height, weight, BMI, visual acuity, and other factors deemed appropriate based on medical and family history, and provide education, counseling, and referral for preventive services. A screening ECG or EKG may also be performed. For a full list of Initial Preventive Physical Exam components, visit CMS's website. To file Initial Preventive Physical Exam claims, use the HCPCS code G0402. If you provide these services at an FQHC, use code G0468. For ECG, EKG screening, use codes G0403, G0404, or G0405. Now, let's discuss the Initial Annual Wellness Visit. This visit is covered once per lifetime. Use this visit as the patient's first annual wellness visit after their first year of Medicare enrollment. During this visit, you should perform a health risk assessment and develop a personalized prevention plan. You should also document the patient's medical and family history, measure height, weight, BMI, and blood pressure, assess cognitive and functional ability and depression risk factors, and provide education, counseling, and referral for preventive services. For a full list of Initial Annual Wellness Visit components, visit CMS's website. To file a claim for the Initial Annual Wellness Visit, use code G0438. If you provide these services at an FQHC, use code G0468. Now, let's talk about subsequent annual wellness visits. Use this visit after a patient's initial annual wellness visit. It's covered once every 12 months, beginning after the initial annual wellness visit. The components of this visit are very similar to the initial annual wellness visit, but instead of performing a health risk assessment and creating a personalized prevention plan, you will review and update them. For a full list of subsequent annual wellness visit components, visit CMS's website. To file a claim for subsequent wellness visits, use code G0439. If you provide these services at an FQHC, use code G0468. Finally, we'll go over a few quick tips to help streamline the Medicare wellness visits and avoid claims denials. Quick tip 1. When you provide an initial preventive physical exam or any type of annual wellness visit and a significant, separately identifiable, medically necessary evaluation and management (E&M) service, Medicare may pay for the additional service. Report the necessary E&M CPT code with the modifier 25. Quick tip 2. Sometimes patients get wellness visits from other providers or in other states. If you're unsure about patient eligibility, check My CGS to find out the date that your patient is next eligible for a Medicare wellness visit. Quick tip 3. Create efficiencies using clinical staff to perform the initial and subsequent annual wellness visits, saving you time and money. Medicare Part B covers these visits if performed by a physician, a qualified non-physician practitioner, or a medical professional, or a team of medical professionals directly supervised by a physician. We hope this video helped you better understand the purpose of Medicare wellness visits and when to use them, helping you avoid denial of payment, reduce billing errors, and avoid confusion and unnecessary co-pays for patients. For more information about Medicare Wellness visits, visit CMS's website.